Hey, I'm Di McQueen, licensed clinical social worker, family and addiction expert. I'm here with Dr. Brian Jackson, my longtime cohort who specializes in the field of addiction. Welcome to Healing Families Shattered by Addiction.
Di and I have worked with addicts, alcoholics, and their families for over 30 years combined. Our podcast and coaching programs focus on families who have a loved one suffering from addiction. Our experience has been that this disease affects families as much, if not more, than the addict or alcoholic.
Is your world spinning out of control? Are you codependent? Are you experiencing worry, loss of sleep, and difficulty concentrating? If so, you're in the right place. Brian and I have both personally lived it, learned it, and now we're going to teach you tools and techniques on how to get your life back that you thought was shattered by addiction.
Okay, let's dive in.
Brian and I are so excited to introduce to you our new sponsor, Lakeview Health. They are a wonderful residential treatment center. Whether it's the family member who is looking for a place or the addict or alcoholic themselves, this would be the place that we would refer them to. Brian, you have many years of experience with Lakeview.
Yeah, Lakeview Health is a center of excellent addiction treatment. They take an evidence-based approach, medical approach to treating this complex brain disease. They hold the Joint Commission's Golden Seal, and they were voted one of America's best treatment centers by Newsweek magazine. They deliver dual diagnosis, gender-responsive, and trauma-informed care at their gorgeous facility here in Jacksonville, Florida. But they do see people from all over the world do come here to Jacksonville to go to treatment at Lakeview. Their levels of care include medically supervised detox, which a lot of people do need. Then they stabilize them in a residential rehabilitation and partial hospitalization program. They have board-certified physicians, master-level therapists, and they work to address the unique needs of each patient. So in other words, it's not a cookie-cutter program. They help individuals build skills for long-term sobriety. So if you or someone you know needs treatment, please visit their site at lakeviewhealth.com. We also have a hyperlink on our website at familyandaddictionexperts.com where you can just click and get some information about Lakeview Health. And Di, I think you have a number for people to call if they would like to inquire about treatment.
I sure do. That number is 888-480-3799. That's 888-480-3799. Give them a call. Hey everybody, this is Di McQueen, and I'm joined today with my partner in crime, Mr. Brian, or I should say, Dr. Brian Jackson. Hey, Brian.
Hey, Di. Good. How you doing? Good.
I am super good, and I am thrilled to be back with you. We got an amazing topic to continue talking about today on healing families shattered by addiction. So we started talking about how substance use or substance abuse affects relationships and marriage. And, our prior podcast was really talking about how, sort of the minor things that start to happen in the beginning of someone noticing that there's, substance use or substance abuse going on. Today, we wanted to talk a little bit more about like when things start to advance and maybe someone's progressing in their disease a little bit more, or the relationship is breaking down a little bit more because of this. Where things might go and how it might affect, the substance use and or abuse starts to begin to really affect relationships and marriage. So Brian and I are, really excited to talk about this stuff because we know we deal with it on a regular basis of how terribly dramatic this and really devastating effects that the disease can have on people's lives and the relationships that they have. So, B, I'm gonna turn it on over to you, buddy.
Yeah. So marriages, it really can get rough. It can get to where the drinking interferes so much. There's like this cycle of conflict, in the marriage. The substance abuse can lead to, verbal attacks, God forbid, physical conflict, which leads to further disagreements. About the substance use itself. People are being less than honest about how much they're consuming. Let's say the husband is the one that's drinking. The wife feels a lot of times like she's being ghosted, or is he really drinking that much, or is he not really drinking that much? Um, but as it progresses, it can lead to a lot of other problems other than the interpersonal relationship between each other. You can have financial difficulties that are as a result of the drinking. Somebody could lose their job and lose their livelihood. Then next thing you know, there's a divorce or something, and then you've got to think about child custody and go through all of that. And then there's outward consequences, legal consequences. You get a DUI, or get arrested for illicit drug use. Say that alcohol is not your drug of choice, but the verbal and physical is something that at some point you really got to ask yourself, am I in a safe situation? Because the person that's drinking has really got impaired judgment, and the fact that they want to continue drinking and you would like them to stop drinking. We could have all kinds of resentments, and create this atmosphere that is just so toxic and unpleasant that I don't know. It's just where something has to give.
Exactly. And it is rough. I think that sometimes people don't realize, and I myself didn't realize, I always thought I would be that one that could talk to that person, and calm them down or whatever.
Guy is terminally unique.
Right,
He got this,
right.
right?
I did. I used to think that way until I recognized actually what drugs and alcohol, you've heard us and others, recognize what that does to your brain. And thinking that your person is your person is really not a good call in
Right.
that time, right? At any given moment when that person is impaired, there's a myriad of things that they can do that you would never dream that they could do or would do. And they may not even realize that they're doing it. So even as far as going to the point of sexual abuse, right?
Yeah.
So, we want to really stress to people that, you're dealing with, I always call it the twins, right? Where,
Yeah,
you
and it's like, we love them and we're like, God, how could they be acting like this and, acting like this towards me? And then sometimes, you're delaying the inevitable, and like you said, Di, the abuse can take, several different forms, be it physical, sexual. Obviously the verbal is typically where it starts, but it's just so imperative, I think, that you do not give them the benefit of the doubt once there is, a physical threat to you or you've been physically injured. At that point, you really need to take care of yourself. And if you have to call, the legal authorities or report it to a healthcare provider, or a substance abuse treatment professional, they'll pretty much know where to refer you to and direct you to so that you're safe. Because the most important thing is to put yourself out of harm's way if you feel threatened like that.
absolutely. And that's a question we get asked a lot. Like, so do I have to leave him? Do I have to do this or do I have to leave her or whatever? And, Brian and I are not allowed to tell you what you need to do. What we do tell you is you need to be safe, right? So we would always suggest, making sure that you have, a few bucks put aside, some clothes packed or whatever, so that at least until things calm down, you can be in a safe environment. We don't want anybody in a situation where there is potential to be really harmed. And we will never tell someone that, you have to leave your husband or wife or whatever for good. But we would suggest strongly that if it's in a situation where there's somebody being, hurt, that we ask you to try to leave that situation at least temporarily to be safe. And I think that's a really important thing for people to hear, where things calm down. Okay, we can work some stuff out with some very strong boundaries around that, which leads us into how you best support your partner, right? And
Yeah, I mean, how do you support them without enabling them?
right,
Because I think in the past we've made excuses for them, we've covered up for them. We've even lied to ourselves and said, it's going to get better or it is better when it really isn't better. But, we want to continue to love the person that we fell in love with, and we're married to now, who unfortunately is not well and in their, addiction. So, offering support to an addicted spouse or partner, takes a toll on your physical energy, your emotional health. So, the needs of the rest of the family sometimes can get neglected, like children or aging parents. And then maybe your demands at work, you're so fragmented that you're not able to do, the best job you're, capable of doing. So enabling occurs when one partner, usually without, conscious intention, you're not trying to keep this alcoholism or substance use going, makes it possible, for the other person to continue to do that. So examples of enabling behavior include, allowing a loved one to neglect their responsibilities. So all of a sudden you take over their responsibilities, you've got your responsibilities, and it's almost like having somebody who is, debilitated in the next room. So you have to step up and do everything. So and then also letting somebody abuse you. Um, Really, that's where you have to set a boundary. I mean, it's not okay, for people to abuse you, and then always making excuses for them. This is why they couldn't come to the graduation. This is why they didn't show up at work. You know, and then you're really sucked into being less than honest, and you're not going to feel comfortable with yourself because you've got this secret, and you're lying to cover it up. So it boils down to you neglecting yourself to help somebody else that's in trouble. So
Absolutely. And I mean, I think that's the really confusing part, right? Which is it's one thing if you have accepted the fact that live with, you are in love with, you are married to a drug addict or a substance use disordered person, right? Who is abusing alcohol and or drugs. And you make a decision and someone says, where are they? You go, well, they're not in a good place tonight. That's a different issue when you're being 100% honest about it. And I made a choice to do that and leave them at home and they understand or whatever you guys choose to do. That's a different issue.
yeah, so like the difference, Di, that you see, like the difference between enabling, your partner
Yep.
in their addiction or supporting them. Um, how do we do that? Like, and I think that's a question we get a lot from a husband or a wife. Like, okay, I get it. I am enabling them. I don't know what to do. How do I support them without, like just saying, okay, let's get divorced, and be done with it.
Right. I mean, I think, there's kind of like that buzzword that goes around a lot, right? That codependency.
Codependency, yeah, for sure.
And it's really codependency is so deep and wide, and we could probably do 40 podcasts on codependency and barely begin to scratch the surface. But the biggest thing that comes to mind, like right off the bat, is when I'm enabling a person, I know when I lose myself, right? And I'm not doing the things that I know I need to do to take care of me and those that can't. So, for instance, little kids, you mentioned, elderly parents, animals,
Right.
and our focus is on that person rather than everyone else around us. You're pretty sure that you're enabling. Okay. There's a pretty clear distinction. If I am able to do the things that I need to do and I need to focus on taking care of myself first and, the ones that need me, right? And, this person often in their use and substance use will try to convince you that you're not showing them enough attention. You're not doing all these things for them because you're too focused on these other people. You go, that's a big cue, right? For you to go like, wait a second. These are our children who need to be fed, right? Now it's different if you're, running around doing certain things, but if your self-esteem is starting to go into the gutter and you're starting to feel like I'm questioning everything about me, I don't know if, like, am I going crazy here? I don't set boundaries, so setting healthy boundaries is going to be really, really important.
Yeah, that's a real important question to ask,
Yeah.
ask yourself. Like,
Right.
am I setting a boundary or am I just letting this thing run wild? Right.
So here's a thought, right? That goes like this is some of the stuff that I used to do. I used to go through the dialogue in my head about all the things I was going to do and say, right? Like when he gets home, I'm going to tell him this, 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 and this. I'm going to do this. I'm going to set this boundary, and you can't do this. Or if you do, this is going to be the consequence. And then as soon as they walk in the door, everything changes, right? Because the fear comes up. That is not setting a boundary. That is thinking I want to set a boundary. And our second suggestion and recommendation is going to be like, hey, you need to seek out some help. You need to get some support because, we do this dialogue. I was notorious for that, being able to go like, I have these great conversations with myself because I knew And most of us do, and you guys out there that are listening to this, something is not right and that you are going way over the top. You're thinking about it all the time. Your obsession with this person and the thoughts of like, I can't get this out of my head. And, it just goes round and round that merry-go-round. I go, that's kind of a cue to you. Something has gone way far off base, right?
And I think that's when you really need to reach out for help because you don't know what's up, what's down. You're going through these thoughts and how can I set a boundary? And that's where I think, a professional or somebody like us can, help you and guide you in terms of what a healthy boundary is and how do you protect yourself, are you letting the people in your life take responsibility for themselves? That's a question you need to ask yourself. You need to ask yourself, am I seeking help, outside of the home from professionals? Because again, you're just sucked into this very sick, because the person is sick, so the whole thing becomes ill,
Yeah,
if you will.
we all get really, really sick with them. And so, we have to be very careful about going like, I do not own theirs, right? How do I learn how to take care of myself and de-stress myself? Really important question, right? I mean, are you going to the gym and, working out? Do you do a yoga class? Do you meet with a friend? I know I stopped seeing friends.
Right.
Like I didn't have time for that. There was nothing left of me. And that's really important, right? How do I de-stress myself? What are my stress management activities? Hopping in the bathtub for a half an hour, right?
Sure.
Get the kids to bed, jump in the bathtub. Oh no, none of that was happening, was it? Even just sitting down and having a cup of coffee.
Yeah, it's just how do you step outside of this, I guess is the question, and these are, and like you said, I mean, it's almost the alcoholic too intellectually knows they have a problem, but they haven't made the connection between their mind and their heart to say, hey, wow, I got a problem. I need to deal with it. And a lot of times the spouse in their mind goes, wow, this is really not good for me. This is not good for the children. But we overlook it and think that have this hope that it's going to get better. And so there isn't that connection between the heart and the head to say, you know what? I've got to step outside of this. I've got to be, I've got to take care of myself. I got to take care of my kids. This may or may not get better.
Right. And, when we talk about, financial responsibility and things, right? Are your lights getting shut off? Are you able to pay your mortgage when you used to be able to?
Right.
It's different than if things just happen. But is it a direct correlation to the fact that this person cannot get up and go to work because they're too hungover or they were out all night on a 5-day run and they're in the crack house,
Right.
Whatever. That is a serious problem that boundaries need to be set on.
Yeah, I like to keep the daylights out of the obvious. I mean, if something is causing a problem, then it's a problem. So if alcohol is causing a problem, there's an alcohol problem.
Right.
And that's when we, meet with spouses that are so frustrated, and we get the question all the time: can I force my spouse into rehab? Okay, and I don't know. You could take it from there. I mean, there's different ways to try to do it, but I don't know that you can really force them unless you go through a whole rigmarole.
Yeah, and I mean, I think there are times where people are really, really desperate, and there are ways, there are legal actions that can be done. Um, but in Brian and I's experience, we find it best when people actually just sit down and talk to their family members and potentially have someone like us come and talk with them and help them understand, right? Not yelling and screaming and carrying on, but really to sit down and kind of explain like what is going on, how this is, hurting everybody, right? Not just, that this is a crazy person just telling them that they have this problem. Um, we do interventions, but we do it in a way that is not conventional. We're not the TV show.
No sneak attacks. No sneak attacks.
So, because people don't usually respond well when you have, 9 people jumping on you, or whatever. But we do talk to them very honestly, and openly about like what's going on. If this many family members are here, do we really think that they would do that because they don't love and care about you? Of course not. However, if the abuse has gotten that out of control, there may need to be a separation period until this person can learn how to contain themselves and learn how to work through their own issues that is going on with them. And that may be one of the boundaries,
Yeah,
right?
and then and one of the extremes, forcing your spouse into rehab. I don't know if it's necessarily rehab, but get them in a safe place. If they're talking about hurting somebody else or hurting themselves, legally you can make the phone call and they can be observed, for 3 to 7 days to see what's going on with them.
Right. And even if you don't feel like you can actually force someone into, because again, you can try your best to kind of say, this is what I like. You can, in fact, though, say there is a boundary. If you don't go do something to take care of yourself, you cannot be here.
Right. You
And
need you
so,
need to be able to create a consequence, and really, that's what interventions are.
mhm,
So maybe the person that's got the purse strings, that is giving money to the person that has a problem, says, you know what, if you don't go to rehab, you're not getting any more money. Or as a wife, you might say, you know what, if you don't go to rehab, you're going to have to leave the house, and I'm going to stay here with the kids. Or if need be, I'm going to leave with the children. So, but that's you speaking for you, and that is setting a boundary. And so if you do set that boundary of you're not going to get any more money unless you go to rehab, and they don't go to rehab and you still give them the money, then in the alcoholic's mind, you're not going to change. People are not going to change what you'll tolerate. So that means you'll continue to tolerate the drinking, um, in spite of the fact that it's causing a lot of damage. But again, the most important thing to remember too is that this is an illness, and I think that you know certainly when I was drinking, people could look at me and say, "Wow, he's a bad guy," you know. But not to excuse it away, some of the behaviors that I did while under the influence, I mean, sitting here lucid today, I go, oh my God, what was, what was I thinking? So, but I was sick with this illness. So, I had to get over the fact that I was not a good guy, a bad guy trying to become a good guy, that, I was not well, and I wanted to get well and I wanted to stay well. So, some of the behaviors that spouses see while, their loved one is under the influence is like, oh my God, this guy is, he's not a good person. But you married him in the beginning for probably reasons of love, and so I think that getting back to we've seen marriages hanging by a thread, that after the person gets sober and gets well, that the marriages are better than they've ever been. There's all kinds of communication, intimacy, and everybody's getting real about what's going on.
yeah. And for the first time, maybe ever,
Right.
to be
Sure.
honest. And the one thing to also remember, I think that's so important, is the effect of the relationship. Is remember that the substance is, what people do. The underlying problem has been being masked by, and then the brain is also affected by whatever substance is being used. So once you peel all that back and then really get down to brass taxes about what's really going on here, oftentimes it is a very different scenario, right? We get well, we get healed, and you have this beautiful person that was, the truth is, most people that I know and have met and have worked with over the years are the kindest people. They really are.
Yep.
They have big hearts, very emotional, but they have had a lot of things happen in their lives and they act out because they've never, learned how to deal or cope with whatever was going on. So, remember, there's ways to stop this way before it gets to the financial conflicts, the legal, and, all that stuff. However, when it gets to the physical, verbal, and especially sexual abuse, we got to stop it. We got to stop it and we got to do something. So,
Right.
we really encourage you to get and seek help, way before it gets to that point. But if you're in that state, please reach out to people like ourselves or somebody and encourage you strongly to get help.
Yeah, and a lot of times too, they won't make that decision because they feel like they're being selfish, or they're abandoning somebody. But really, what you're doing is taking care of yourself, taking care of your children, and by doing that, that consequence may be the trigger that gets your loved one to say, you know what, this alcohol is causing a lot of problems. I'm ready to to face it. So yeah, it's an interesting dynamic. I don't know how. It's a complicated dynamic.
It's
I get
very,
it. It's
very
complicated.
complicated. And the thing that I always remember and think about, which is I don't want my children to learn this.
Exactly.
Right. And I didn't know those kinds of things. Right. But the understanding is this, they see this. And if they see you allowing this kind of behavior, we're teaching them that that's okay.
Exactly.
And so it's not okay. It's not okay to be abused. It's not okay for your children to abuse you. It's not okay for your loved ones to abuse you. And it's not okay for us to abuse others.
Yeah, I think a lot of times we think that the children are not watching, that they don't see this. They're almost like invisible, when in fact they're soaking up all of it. And a lot of times when we point that out to a parent, that is when they get on their horse and ride and go, oh my goodness, I didn't realize how much this, is affecting my children. And you wouldn't want to hurt your children intentionally.
Stay tuned. Another podcast coming up.
All right.
All right. On that one.
Yeah. Okay.
On that particular topic.
Right.
We're going to talk about that. We think that that's very, very, very important. So hopefully that's just a brief overview. We're always here for you guys. We love the fact that you're out there and growing in popularity. So again, thank you for this one. And please reach out for help if it's advanced to this stage.
Yep. You can check out our website, familyandAddictionExperts.com. There's a lot of information on there. There's a family survival kit that's no charge, that you can download some of these articles and subjects that we talk about.
Fantastic. Always a pleasure being here.
Yes. Thank you, Di. Thank you.
Thanks so much for joining our podcast, Healing Families Shattered by Addiction. We'll be back in a couple of weeks with more important tools, techniques, and ways for you to focus on you instead of the alcoholic or addict in your world.
Until then, please go to our website, familyandAddictionExperts.com. That's familyandAddictionExperts.com. You'll also see links to our Facebook and Instagram pages. Please also, if you have any emails that you would like to send us, that's info@familyandAddictionExperts.com. That's info@familyandAddictionExperts.com. With any thoughts, feelings, questions that you may have for us, we would love to hear from you, and we look forward to seeing you in a couple of weeks.